Hi everyone, my name is Melina McCabe and I am a sophomore biomedical engineering student at West Virginia University. I am from Wheeling, West Virginia and really enjoy being involved in research here at WVU. My project is titled Differences in Stepping Characteristics During the Tug Test with Aging and Neurodegenerative Disease. When you walk, how you step has a large effect on your balance and walking stability. Stepping parameters, such as step length and step width, quantify our walking characteristics. Abnormal stepping parameters may indicate that walking stability and balance have been altered. Underlying conditions may lead to a decline in walking performance, which would most likely lead to large changes in stepping parameters. In this study, we were interested in how walking is affected by aging and neurodegenerative disease. Neurodegenerative diseases are progressive diseases that affect the brain and nervous system. Aging causes a decline in balance and muscle mass and has a similar effect on these systems. For people with these conditions, even small differences in stepping parameters may contribute to an unsteady gait and difficulty walking. In this study, multiple sclerosis, or MS, was the neurodegenerative disease of interest. This progressive disease affects connections between the brain and nervous system and affects over 2.3 million people worldwide. We know that aging and MS lead to difficulty walking, but the mechanics of why walking is altered with these conditions are not fully known. If we can understand the mechanical changes that are accompanied by these conditions, we will be able to help clinicians develop more effective rehabilitation strategies that can drastically improve quality of life and lower the risk of falling for those affected by them. In this study, we want to understand how aging and neurodegenerative disease affect walking. The specific goal of this study is to determine how walking step parameters are modulated during the timed up and go test with aging and MS. We hypothesize that step length, step width, and their variabilities will be moderately affected by aging and MS, which may reflect the loss of balance and gait control that often accompanies these conditions. For the experiment, 5 healthy young adult subjects, 1 middle-aged adult subject, and 1 middle-aged adult subject with diagnosed MS were tested through a series of walking trials. Vicon motion capture cameras and reflective markers were used to capture step parameters. Figure 1 on the right shows a picture of the experimental setup in our Vicon software. The colored lines are representative of the markers that the cameras, which are shown up top, are able to pick up. Each subject completed a minimum of 4 trials of the timed up and go or tug test. The tug test is an important clinical benchmark that can show walking independence and stability. During this test, subjects stand from a chair, walk 3 meters, turn, and walk back to the chair as quickly as possible. Figure 2 shows an example of how the tug test is performed. This test is often used as a clinical benchmark because the movements in the test, such as the sit-to-stand motion and the turn, are challenging scenarios during which falls often occur. The subject's ability to complete the tug test can be a very good indicator of their walking ability. This video is of one of the subjects completing the entire tug test. Our data was analyzed using a custom-made MATLAB code. Step length and width were calculated as distances in the anterior, posterior, and medial lateral directions respectively. Step variabilities were calculated as the standard deviation of step length and width between all steps. Step parameters were compared between the 3 groups. Figure 3 shows how step length and width were defined in this study. Effect size was then used to compare results between the groups. Results show that step length and width are affected by MS, but not aging. Figure 4 compares step length between the groups of subjects. On the x-axis, we have the 3 groups, starting with young adults, which are graphed in blue on the left, aging, which is graphed in purple in the middle, and MS, which is graphed in gray on the right. The y-axis shows step length in millimeters. As shown in this figure, step length largely decreased with MS as compared to the healthy young adults. However, step length stayed roughly the same with aging. This is most likely because people with MS often take shorter, slower steps to maintain stability. Taking shorter steps increases stability by providing greater overall balance. Furthermore, a large increase in step width was found with MS. Figure 5 shows a plot of step width versus condition, with the same groups and colors present on the x-axis and step width in millimeters on the y-axis. As shown in this figure, step width was greatly increased with MS. Step width was not affected with age. This is most likely due to the fact that people with MS use a larger step width to cope with gait instability. A wider step width increases the subject basis of support, which increases their overall balance and leads to lower changes in foot placement. Further results show that step variabilities are affected with aging and MS. Figure 6 shows the same groups and colors on the x-axis and step length variability in millimeters on the y-axis. As shown in this figure, a large increase in step length variability was found with aging. This is most likely because consistent foot placement is harder to maintain with age. Inconsistent step placement is a sign of an unsteady gait, so this change most likely reflects the instability the subject felt during our experiment. Also, a large decrease in step length variability was found with MS. This change in step length variability reflects the shorter and slower steps found in this subject, as shorter steps would lead to lower step length variability. Lastly, a medium increase in step width variability was found with MS. Figure 7 shows the same three groups and colors on the x-axis and step width variability in millimeters on the y-axis. This increase is most likely due to the increased step width found with MS. As step width was increased above what it would normally be to increase stability, more variability in the width of these steps also occurred. No change in step width variability was found with aging. This study demonstrates that both aging and multiple sclerosis result in altered stepping characteristics that are often associated with gait instability. These altered stepping characteristics represent underlying physical changes that lead to an increased fall risk with aging and MS. These results could eventually help develop more effective rehabilitation strategies and techniques for people with these conditions. It's important to note that sample size was a limitation in this study. While we had 5 healthy young adult subjects, we only had 1 subject with MS and 1 middle-aged subject. To make this study more representative of people with these conditions, we would need to expand the sample size to better show how stepping parameters are affected. One important conclusion to draw from this study is that the subject with MS and the middle-aged subject responded to instability differently. Overall, the subject with MS took shorter, wider, and more consistent steps, while the middle-aged subject took similar steps as compared to the young adults but had a much higher step variability than them. These differences in response to difficult walking conditions could either show that the subject's motor skills were affected differently by their respective conditions, or that on a more personal level, they chose to react differently to the instability they felt in this situation. Either way, this study lays the groundwork for future investigation into this topic that should focus on determining the cause of these changes. Future work should focus on finding the underlying reason for the changes in stepping parameters found in this study. This study should also be repeated with different neurodegenerative diseases to determine differences in walking step parameters between conditions. Repeating this study with other conditions, such as Parkinson's disease or ataxia, will give us a much better picture into how multiple sclerosis affects walking. I would like to thank my mentor, Dr. Jessica Allen, and the members of the legislature for attending today.